This is the Mid-America PTTC podcast, where we believe prevention is better together, and together we are stronger. I'm your host, Steve Miller. This is episode 51, and in today's podcast, I have the pleasure of speaking with Dr. Ira J. Chasnoff, MD, an award-winning author, researcher, and lecturer who is president of NTI Upstream and a professor of clinical pediatrics at the University of Illinois College of Medicine in Chicago. He is one of the nation's leading researchers in the field of child development and the effects of environmental factors on the developmental trajectory of children and adolescents. He also has worked with a wide range of states across the nation and internationally in developing universal outreach and early intervention programs for children and families affected by trauma or substance abuse. Before we get into the content, we would like to thank our funder, the Substance Abuse and Mental Health Services Administration. Quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Not only do we have a lot of ground to cover today, I'm really excited to have this conversation, so let's get started. Welcome to the podcast, Dr. Chasnoff.
Thanks, Steve.
This is really exciting. For the audience's background, I saw a presentation that Dr. Chasnoff did at a Drug Endangered Children conference in the state of Iowa recently, and we'll get into some of the reasons why he captivated me as we have this discussion. But suffice it to say that he makes a very complex subject matter very relatable, very understandable. And for those that follow along with the Drug Endangered Children work that the Mid-America PTTC does, you'll soon find out some of the work that Dr. Chasnoff has pioneered that might help you in your community's work. So we always like to try to set the stage a little bit, if you will. What exactly was kind of that path to prevention around risk factors and the work that you do? How did this become what you wanted to do for your life?
Well, I had no idea this was what I was going to do. I was in general pediatric practice, and I volunteered to open a developmental clinic for babies coming out of the neonatal ICU. And I was running that clinic and found this population of babies that just didn't fit anything we knew at that time. This was back in 1976. So that I began looking at those infants, and it turned out these were babies whose mothers had been using heroin during pregnancy, had come into the hospital to deliver, went home, and the babies were in the neonatal ICU for 6-8 weeks going through drug withdrawal. So I went to the hospital and said, okay, I'm going to turn the developmental clinic over to somebody else. The truth was I was getting bored with it. And I'd like to start a program for pregnant women who are using drugs. And they thought I was crazy, but to their credit, they gave me permission. And so with zero budget, we opened the first drug treatment program for pregnant women in the country. I got 2 of my obstetrics friends to volunteer to serve as the obstetricians for the pregnant women. I got somebody from the substance abuse treatment department at the hospital, and I got a nurse to help me as the pediatrician, and we opened a clinic. We clearly had no idea what we were doing because there was just no information at the time. But the program grew, and within a few years, we were seeing 150 pregnant women a year, delivering services. And I was running the follow-up program for the children. And so my earliest work was on heroin exposure and developing a methadone treatment program for the pregnant women. By about 1985, a new drug was coming to Chicago called cocaine. And we published the first study on cocaine use in pregnancy in 1985. And it all just kind of went from there. So I left my private practice and my volunteer work took over. And we started applying for and getting federal grants to do studies in a brand new emerging field. So that's where it all started. So my oldest children that I have followed since they were born, some of them I worked with their mothers, so even before they were born, my oldest children now that I'm still in contact with are in their mid to late 40s. And I still follow them and help them along the way. So that's the story of how we got here today.
Well, that's a common theme when you ask people what was your path to prevention. Most people say, wasn't really what I was looking to get into, but this is how I got into it, and it becomes really just kind of an interest for most people. And if they stick with it, it seems like it just becomes a passion that takes on the life of its own. And it's certainly clear that that's the case with your work. Now, what I'd like to try to tie together is, talking about the work that you've done and are continuing to do. When I read your bio information, it talks about exploring the biological and environmental factors that impact the ultimate development of high-risk children and presents practical strategies for helping children reach their full potential at home and in the classroom. And so with that in mind, the question that will bring it a little closer to home is not only are you aligned with the kind of the drug endangered children initiative or alliance in Iowa, but beyond that, but that is the connection there, is what they're trying to do with drug endangered children is really try to get to those children prenatal or postnatal and the families. And so how is it that you got connected with DEC, and how is your work really something that people that are in the DEC movement, something that they could access and utilize?
Well, my real work today is building systems so that we bring together people from the healthcare system, from substance abuse treatment, from early intervention, from all of the behavioral health services in a community or state, bring them to the table to develop a system of care. And so that's how DEC gets involved, because they take the children, once they're looking at children, once they're endangered from drug exposure, either prenatally or environmentally, what can we do to make life better for these children? So what has been shown through research is that the earlier you identify these children and get them into services, the better they do long-term. The best way to identify them early in childhood is to identify their mothers during pregnancy. So we develop prenatal screening programs. We've published the only validated screening instrument for pregnant women that looks at substance use, domestic violence, and depression. And so we can identify those women, develop a plan of safe care for the child before the child is ever born, and then implement that plan as soon as the baby is born. And what we've shown through our research and our work is that you get significantly better outcomes when you start early like that. So we've got this kind of work going in about 40 states, also in several countries overseas also. It's all about bringing people to the table and developing science-based prevention and intervention. And you get improved outcomes.
That's what impressed me, just hearing you present and then listening to you talk today, that what you're saying kind of flies in the face of what a lot of people hold to be kind of a reality. One, that there's really no recovery, if you will. And two, if a child's born into this, they're kind of stuck in this life. It's like there's no way out. And I know DEC is working to change that reality. But what you're really saying from a scientific perspective, there's proof that shows that this really is a possibility. If you get the right combination of modalities together, you can help the mother or the family and the children have a completely different life.
Absolutely. The key, again, from the research, the key is if you can identify the child and get them early intervention services before the age of 6, you can significantly improve the long-term developmental trajectory. It's never too late. We've done studies, and we developed a curriculum, for example, for 6 to 12-year-olds who were prenatally exposed to alcohol and drugs. And what we showed through that curriculum was significant improvement compared to a control group that didn't get the treatment, significant improvement in executive functioning and in emotional regulation, which means that they make better decisions. They're less likely to end up in jail. They're less likely to start using drugs themselves. They can plan and complete a task. They do better in school. And they don't have the rages and the outbursts like many substance-exposed infants and children do, due to the inability to really regulate their emotions.
In some of the graphics that you showed during the presentation, and we don't have that capacity here through the podcast, but you were able to say this is a snapshot of a brain that was impaired by methamphetamine or cocaine or alcohol, fetal alcohol syndrome, and even in the trimester that maybe those substances were used. When you say things like environmental factors outside of the impact of the substances, what are some of the things as far as like those environmental factors or the trauma? So more maybe postnatal, after they've been born, like just the high stress environments they grow up in, or maybe some domestic violence that's happening. Is that also something you can comment on?
Sure. I'll tell you about a couple of studies that we've published. One is we looked at a population of children, a large population of children, all of whom had been prenatally exposed to alcohol and drugs. So this is a very high-risk population. Now, we know in this population, as they reach childhood and adolescence, children with prenatal substance exposure have increased rates of co-occurring mental health disorders. So we asked the question, why is that? Now, if you looked into the scientific literature, what it said is that these children have increased rates of mental health disorders because of poor access to care, poor access to services. They didn't get early intervention. They don't have the right kind of schools, et cetera. So we said, okay, let's do a study and find out if that's true. And it's kind of a complicated study, but what we showed in this study is that those statements in the scientific literature weren't true. The main predictor of co-occurring mental health disorders was, in fact, early neglect on the part of the parents or the foster, adoptive parents, whoever. But it was early neglect that was the strongest predictor. And what that tells us is that early trauma, you have children that are biologically vulnerable from the prenatal drug exposure. There's changes in the structure and function of the brain so that they're at biological risk. Then if you put them in an environment in which they suffer trauma, that just makes it all the worse. Mm-hmm. So that was one study. The other study I would mention was a study of children in the child welfare system. So again, all of these children had been exposed to drugs and alcohol. And we said, okay, so we know it's early neglect. Now, what aspect of neglect is it? Is it neglect in the home? What are the factors of neglect? And, statistically, the statistical analysis is very, it would be difficult to explain in a podcast. But here's the bottom line. We looked at family factors, we looked at prenatal exposure, we looked at factors in the child welfare system. And what we showed is the specific kind of neglect that was most harmful to the child was actually factors from the child welfare system, specifically the number of placements that the child had. So the more placements, he was prenatally exposed, so he was biologically vulnerable. He has this dysregulation, this inability to, he's a young infant, to manage emotions and behaviors. And then if the child welfare system doesn't support the foster family or the biological family, what happens? The child gets moved, either removed from the biological family or placed in a different foster family if the child is in foster care. And the more movements, the less we support families, and the more we allow these kids to keep getting moved from one family to the next, we're just setting them up for more and more mental health problems. Mm. So you can see that's how you take the science of what we know about the brain and you translate it into policy. So what this tells us is that child welfare systems have to support biological and foster families and adoptive families. We see a lot of adoptive families get sent to us because they're getting ready to disrupt the placement. They can't handle the child anymore. And so they're sent to us. We do an evaluation, develop a treatment plan, and lo and behold, the kid's doing better.
Yeah,
it's amazing.
Yeah,
treatment works.
Yeah, that's really interesting. I mean, I could sit here and we could talk about, different studies that you've done, and I mean, we could take up a long time with that. But I'd like to introduce the audience to a way to maybe connect with you a little more. I've already said that you're an author and you've written a number of books, and I know of the most recent one that you did called Guided Growth. So can you talk a little bit maybe about that particular book and how it's kind of relates to what we're talking about here today? And then, I know you've authored a number of other books. Is there a particular place that someone listening could I want to jump in and start here? Like, where would they begin?
Okay. Guided growth, over the years, of course, as I've written the books, I've depended on what we knew at that point. So guided growth is really the most complete set of information. And everything you heard me talk about at the DEC conference and everything we're talking about today is in guided growth. The subtitle of Guided Growth is Educational and Behavioral Interventions for Children with Fetal Alcohol Spectrum Disorders and Early Trauma. So what we've tried to do is take what we know. We start with the brain science and how trauma affects the developing brain and how prenatal and environmental exposure to drugs affects the developing brain. And then we say, okay, then what are the effects? What do we see from those changes in the brain? So what are the behaviors? And then most importantly, what do we do about them? How do you provide services, help to a child in the classroom and at home? And how do you build that homeschool bridge so that the child is hearing the same thing at home and at school? The book has, it's been very helpful for a lot of people. It has all the latest information, and it has some very practical guides that both parents and teachers can use.
So I guess you would say if someone was interested in learning more about your research and reading about it, this would be the book to pick up and start here and then maybe move on to some others.
Right.
Go ahead.
I was just going to mention one of the interesting things that's going on now is my co-author is Dr. Ron Powell. Ron is the former director of special education for the largest county in the country. He's a brilliant educator. And so we wrote this book together. And what we've done several times now is groups have gotten together for a book club. So so everybody buys the book. We'll assign 1 or 2 chapters at a time. Everybody reads those chapters, sends in questions to us. And at the end of each month, we do a webinar where we give a brief presentation of what's in the chapters and then answer questions and then just have a conversation about those 2 chapters. It's been a lot of fun. Yeah. People have really enjoyed it. And I think it's a way to really get the most out of the book, actually.
Right. That's a really great idea. I would put the challenge out to those that are listening to this podcast. If this is something you're interested in, please feel free to reach out to myself at the Mid-America PTTC. And if we actually had a group of people in our service region that were interested in maybe coalescing with a group that we could possibly do that and learn more about this work from the authors of the material. So let us know about that. You'd also shared something with me before we got started that your son is a partner in a website resource that you have called NTI Upstream, and we'll put the web address in the show notes for the audience if they want to learn more about that resource. But a couple of things about that. One, tell us a little bit about NTI Upstream and kind of like what its mission or vision is. And then we'll talk a little bit about your son's role in filmmaking, which I think is kind of fascinating.
At this point in my career, I started when I was 12 back in 1976. That's not true. But anyway, I started this work in 76. And at this point in my career, I want to take what I've learned and use it to help families and communities address the needs of these families and children. And so my son graduated from USC Film School. He's a very talented filmmaker, has won awards, has testified in Congress around some of his, I'm bragging now as a father, has testified before Congress about some of the films and his documentary films that he's made. But he began working with me almost 20 years ago now. And he has a whole social media team. So he takes the science, I provide the content, the scientific content, and he translates it into social media. And so we work with several states and communities in developing social media campaigns, not only around prevention, but also supporting the appropriate interventions and treatment for children with prenatal environmental exposure. And we've done several major documentary films. The most recent of which I think that your audience would be interested in is called Moment to Moment. It's about 4 young people, ages 16 to 22, all of whom were drug and alcohol exposed. And I've been following them since they were born. So what are their lives now? You hear a lot of talk about newborns, about young children, even school-age children, and there's some interest in adolescents even, but rarely do you hear about young people who are making that transition to adulthood, to independent living. What is life like for those young people, 16 to 22, who have been clearly affected by prenatal substance exposure? What is life like for them now? What is life like for their families? And it's a fascinating film. It's a 1-hour documentary. It's been shown on a lot of public television. And a lot of families, you will get a copy of the film and then take it to school. And so if their child, and they'll have the school, as part of the IEP, they'll have the school watch the film to understand really what needs to be done for their child. So it's available, both the guided growth and moment to moment are available on our website. Mm-hmm. Also, guided growth is available at Amazon.com. So they're easily found.
We'll make sure and put whatever connections we can to your work in the show notes so people can find that information. So essentially your website, the NTI Upstream, I mean, there's resources there, the books or maybe the documentaries and then there's also, depending on who's listening in the audience, there's also some services that you can provide or some other partners that you have on presentations or workshops and those kinds of things that are available if they're interested.
Yeah, we have a full faculty of doctorate level clinical psychologists. We have therapists, education specialists. So we have a wide range of trainings and educational programs, both live and online. So you can find all of
this stuff is fascinating. Like I said, we could talk about it for hours, but I just wanted to give an introduction to our audience. I think they could learn a lot from your research and some of the materials that you have available. Before we get away from one another, I always want to have at least one parting thought. What is like one thing that you would want to make sure that the audience knows, or maybe that you would say, do this to maybe further the kind of work that you're doing or understand it better?
Yeah, I think if there's one message I'd want to leave you with, it would be that these children, you hear the term high risk. You always hear about high risk children. And I would want to remind your audience that risk is not destiny. A child may be at risk, but that doesn't mean there's no hope. And what the science tells us, what research is telling us, and what my own clinical experience tells me, that you can make life better for these children. And so that would be your challenge, is not only be concerned about the risks they face, but look at the positive aspects. What are the positives for each child? And then how do you build on those positives from a perspective of strength? So that the child long-term, I have some real success stories out there.
Well, I'm interested in learning more about it, and I hope that you sparked some interest and curiosity from the audience, because especially for those that are used to the drug endangered children work that we're aligned with, and if they're doing it in their community, I think this is a good resource, and you have some valuable research that could be applicable to their works in their community. So, I appreciate you taking the time to be with us today. It was a great conversation, and we'll get the audience connected to your work again in the show notes. But thank you again for being the guest.
Thanks, Steve. It was a pleasure.
Thank you for listening to this Mid-America PTTC podcast. To learn more about any upcoming trainings, visit pttcnetwork.org and look under your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.